guys, is all about the urinary system. The urinary system consists of 4 main parts: the kidney, the ureters, the urethra, and the urinary bladder. The kidney has a couple of subdivisions, but we'll go into that later. The primary function of the urinary system is to filter out waste from the blood and excrete it as urine. In order to understand this whole process, we need to look into the anatomy of a kidney and their functional units, nephrons. First, let's talk about the important parts of a kidney. The kidney consists of 4 main layers. The first one is the renal capsule, which is the outermost layer. This covers the kidney and is almost like a protective shell. Next is the renal cortex. The renal cortex is a layer right below the renal capsule and is responsible primarily for the filtration of waste from the blood and the creation of urine. Next, we have the renal medulla. The renal medulla is the 3rd layer from the top of the kidney, and it consists of renal pyramids that help maintain the concentration of urine. And lastly, we have the renal pelvis, which is the deepest layer of the kidney. The renal pelvis mainly brings urine down from the kidneys to the ureters, which then bring it to the urinary bladder, then urethra, and then out it goes. Whoosh. Okay, no. Now, I've been yapping about these things called nephrons for quite a while, so you might be asking yourselves, what are these? And moreover, what do they do? Nephrons consist of many parts that each do their own separate thing. There are 2 types of nephrons: cortical nephrons and juxtamedullary nephrons. Cortical nephrons are usually much shorter than juxtamedullary nephrons, and they're primarily responsible for the composition of the blood and moreover what's in the blood and what isn't. They typically don't have a lot to do with water, which is where the juxtamedullary nephrons come in. Juxtamedullary nephrons are a lot larger and usually play a crucial role in the concentration gradient of urine in the renal medulla. They also maintain the body's water balance and how much water is excreted/reabsorbed. And before we talk more about the parts of the nephrons and what they absorb, we have to take a look at how blood actually enters the kidneys. The main blood vessels of the kidney are the renal vein and the renal artery. In my opinion, the next concept I'm about to cover is the hardest in all of the urinary system. So if I were you, I would recommend pausing the video and slowing down every time you don't understand something. Rewatch the video until you understand it. In order to get blood to flow into the nephrons, the renal artery has to split up into smaller things. These smaller things are called arterioles. When arterioles first enter the nephron, they are called afferent arterioles. Once they exit the blood, they're then called efferent arterioles. Efferent arterioles then branch into smaller subdivisions, which then comprise of a huge capillary network consisting of very small veins from the renal vein and really small arterioles from the efferent arteriole. And normally the vasa recta are usually a lot shorter in cortical nephrons or sometimes don't exist. In this case, the efferent arteriole directly branches off and connects to another vein that then returns blood to a branch of the renal vein and then soon to the renal vein. The vasa recta also supplies blood to the renal medulla and is a huge part in the concentration gradient of the renal medulla. Now that we know how fluid enters nephrons, let's talk about how they reabsorb stuff and the whole process of urine. When blood first reaches part of the nephron, it enters something called the glomerulus. The glomerulus is a system of capillaries that flow through something called the Bowman's capsule, which is a capsule that surrounds glomerulus. The glomerulus has pores that allow substances to be filtered out and allows fluid to flow down more through the nephron. Anything that is not filtered then goes back up into the efferent arteriole and then back up into the process I mentioned earlier. Once blood is filtered by the glomerulus, the remaining filtrate that is left enters something called the proximal convoluted tubule. Here, some things in the filtrate get absorbed. Some of the substances that get absorbed include sodium, glucose, bicarbonate ions, as well as urea, which is the compound of the breaking down of nitrogenous waste in your body. Now, let's talk about some of the proteins that help make this possible. Sodium is facilitated in or out of the proximal convoluted tubule by a protein called sodium ATPase. The protein that facilitates the exchange of glucose is the SGLT, also known as the glucose cotransporter. And lastly, what helps bring sodium back into the vasa recta and the capillary system is the NHE3 protein. Keep in mind that some of the substances in the filtrate passively diffuse and go into the vasa recta, and this is how they return back into the bloodstream. This process of diffusion is really important when it comes to the reabsorption of substances into the blood, and that's what makes the vasa recta such a crucial part of the nephron. Next, let's talk about the concentration gradient. After the filtrate passes through the proximal convoluted tubule, it enters something called the loop of Henle. Now, the loops of Henle are the main parts of the nephron that comprise the medulla, which is what helps create a concentration gradient. And the way the loop of Henle accomplishes this gradient is from two subsections. The loop of Henle consists of the descending limb and the ascending limb. The descending loop of Henle consists of aquaporins, which are proteins that allow water to flow in and out. Water that flows out of the loop of Henle flows into the medulla, which then flows back into the renal pelvis and down the ureters, where then it is excreted. However, water that is reabsorbed goes back into the ascending loop of Henle, where there are no aquaporins, meaning that area is insoluble to water. In the ascending loop of Henle, however, solutes are excreted or reabsorbed, including the sodium-potassium cotransporter as well as NKCC cotransporter. These two proteins primarily let sodium, chloride, and potassium ions flow out and in of the loops of Henle through active transport. Now that water and solutes have been excreted or reabsorbed from the loop of Henle, the remaining filtrate alongside the new things from the loop of Henle then flow into something called the distal convoluted tubule. The distal convoluted tubule is very similar to the proximal convoluted tubule in terms of substances that flow in and out of it. And these substances include sodium, chloride, bicarbonate, and are regulated by the same proteins. However, in the distal convoluted tubule, you can find a protein called a TRVP5, which is a channel that allows calcium ions to flow in and out of the distal convoluted tubule. Note that the distal convoluted tubule is in the renal cortex. After things are reabsorbed or excreted from the distal convoluted tubule, they flow into something called the collecting duct. The collecting duct is primarily located in the renal medulla. In the collecting duct, water, sodium, and bicarbonate can be reabsorbed, and the diffusion of water is mainly secreted by a protein called aquaporin 2, which lies on the lining of the collecting duct. Sodium is transported in or out of the collecting duct via a protein called ENAC, and lastly, bicarbonate ions just flow in from bicarbonate transporters. A couple of other key substances that are excreted include potassium ions and hydrogen ions. After filtrate passes through the collecting duct, it then empties into the renal medulla, then to the renal pelvis, where all of that then goes to the ureters, then to the urinary bladder, and out it goes from the urethra. This is the entire process of urine. Now you might be wondering what controls how much urine is outputted and how much is reabsorbed. Let me introduce you to RAAS, also known as RAS. This is called the renin-angiotensin-aldosterone system. First, let's start off with renin and angiotensin. Renin is released by the juxtaglomerulary cells in your kidney. In addition to that, angiotensinogen is released by the liver. Both of these are released in response to low blood pressure. Now you might be wondering what angiotensinogen actually converts to. In a three-step process, angiotensinogen converts to angiotensin 1 and angiotensin 2. The release of renin helps convert angiotensinogen to angiotensin 1, and then later when angiotensin 1 releases the lungs, and once it reaches the lungs, angiotensin 1 gets turned into angiotensin 2 by an angiotensin converting enzyme. Now you might be wondering what the effects of angiotensin 2 are. Angiotensin 2 narrows and dilates blood vessels that increase blood pressure. Additionally, increases the water reabsorbed in the collecting duct, and also signals the next thing, aldosterone. Aldosterone is released by cells in the adrenal gland and helps with reabsorbing salt and water that increases blood pressure and decreases urine output. And now, the final section of this video, the diseases. Acute kidney injury is the sudden loss of blood to the kidney due to many reasons. Shock, glomerulonephritis, erythematosus, and sickle cell diseases are all causes that can cause acute kidney failure. But you might be asking, what is glomerulonephritis? Glomerulonephritis is the inflammation of glomeruli. It usually comes from a variety of underlying conditions and diseases and is mainly characterized as an autoimmune disease. Similarly, the kidneys have a lot of other autoimmune diseases. Lupus nephritis is the inflammation of a kidney. Additionally, other parts that are not in the kidney also have urinary diseases. Urethritis is a bacterial infection that infects the urethra, and cystitis is a bacterial infection that affects the urinary bladder. A lot of these things can be treated with antibiotics and certain diuretics. Diuretics are a type of drug that increase water output, and this usually flushes out bacteria from your urinary tract. There are multiple types of diuretics, but I'll leave a few on screen for you to research more, as the main point is that diuretics help clear up urinary tract infections. Next, let's talk about kidney stones. Kidney stones are deposits of materials within the kidney that form a shape similar to a stone. Kidney stones are also called renal calculi, and men are usually more prone to these than women. There are 4 main types of kidney stones. Most of these come from the shape, but some of them also come from the main compounds they're composed of: calcium, struvite, cysteine, and uric acid. Kidney stones can be prevented with proper dieting and proper hydration, and they can be treated with surgery and ultrasound technology. Next, let's talk about the extreme cases of kidney in the case of renal failure or chronic kidney disease. Both of these involve impaired kidney function that doesn't allow the kidney to do what it's supposed to do. In this case, there's treatment called dialysis with 2 types, one being peritoneal and the other being hemodialysis. Hemodialysis is where blood is passed through a dialysis membrane that squeezes out toxins and returns the blood purified back into the bloodstream. Peritoneal dialysis is where blood is sent to the peritoneal membranes in the stomach or abdominal cavity, where the peritoneal lining acts as a dialysis filter membrane and filters the blood, where it is then reusable and sent back into the bloodstream. At one point though, dialysis might not work and patients might require a complete transplant of the kidney. Another small condition is called urinary incontinence. Urinary incontinence is the inability to control your bladder and urine output. Diuretics usually treat this, and there's a couple main types of urinary incontinence, but I'm not going to go too deep into that. Finally, let's go over some tests on how to detect kidney disease. Albumin is a protein that is created by the liver that is responsible for maintaining oncotic pressure in blood vessels. Excessive amounts of this suggest that glomeruli and the nephrons aren't working properly, and that there's probably some sort of underlying autoimmune disorder near the kidneys. Creatinine is the breakdown of muscle metabolism, and excessive amounts of this in the bloodstream also suggest that there is some sort of autoimmune disease in the nephrons and kidneys. So that's it for the video. I really hope this helped, and I look forward to making more videos on systems, but currently I'm still looking for a topic, so I'll take any suggestions in the comments. Be sure to subscribe and have a wonderful day.